Hello everybody, welcome to the next episode. This episode I'm going to be going over root canals. Now, the thing with, I know last episode I said I was going to go over periodontal disease, but I felt that it was important for me to go into the next step of what happens after, what happens if you don't get your cavities taken care of and you start feeling pain. So without further ado, I'm going to be going into root canals. Now, to mention again, I'm not a doctor. I've just been in the field for well over 10 years now. I know a lot of research. Well, we do have a lot of doctors here in the office. I do talk to a lot of doctors on a daily basis, and I've seen a lot of cases. So one of the things that I've noticed with everything in the dental field specifically, as well as in the medical field, is that people have a hard time understanding what are the words and terms that doctors use on diagnosis on what it is that you have. So as I said before, the reason why I'm doing this in our practice is to educate the patients and everybody that's watching on what it is that they're getting done in a more simpler explanation. So root canals. What is a root canal? A root canal, again, like I said, is what happens normally after a cavity gets to the nerve in the tooth. Now, do you only get root canals when the cavity gets to the nerve of the tooth? No, not necessarily. So for example, if you had an accident, it could be a motor vehicle accident or you're playing with your friends, or you're walking and you turn the wrong way and you banged your mouth and a tooth fractures, it breaks, the piece breaks off. If the break is either close enough to the root or in the root, which at that point you'll start feeling pain, those are also situations where you would need to get a root canal. Those are normally one of the two reasons that you would need a root canal. There are other situations, which I can't think of right now. Actually, just cut that part off and go into this next bit. So those are primarily two major reasons for why you would need a root canal. So when you need a root canal, the reason why that happens, as I explained before, is because your nerve now is exposed to the environment. It's outside. It's not being protected by the tooth anymore. So here I have a model, and this is an example of a tooth that has an infection. So what happens here? Okay, there we go. So what happens here is you have the cavity is going down and it reaches to the nerve. Now, normally in the beginning portions, when this first happens, you don't tend to feel pain. What can happen, in most occasions, is that you'll start feeling like sensitivity, and then at some point you'll start feeling pain when you drink cold stuff. Now, normally if you're drinking cold stuff or you're eating cold things, you'll feel like a shock of pain primarily. Once it starts happening when you're also drinking or eating hot stuff, then what that means is that it's essentially reached this part right here of the tooth, which is your nerves. So normally when you go to the dentist, and the dentist, when they look at the x-rays and they'll see that you have a cavity on the tooth that's it's close to the nerve, based on what it looks like on the x-ray, they'll ask you, when does it hurt? Does it hurt when you eat cold and hot stuff? And the patient will sometimes say, no, it only hurts when I drink cold things. Then the doctor says, okay, well, that person more than likely might not need a root canal. But if the person says, yeah, it hurts all the time whenever I drink something cold or I eat something hot like soup, it'll hurt me. That's normally an indicator that the cavity has already reached the nerve. And what happens is that you have a hole now going from the top of the tooth or in any direction all the way down to your nerve, and that is why your nervous system is exposed to the environment. So any cold or hot seeps in through the hole and touches your nerve system, and then you get like just a quick impact of pain. That's normally how it starts. After that, and it can happen at any moment, the infection gets into the nerve, and then that's when you start getting continuous pain, because the bacteria, once it gets to the nerve, it infects the nerve, and now you have pain all the time, and you want somebody to rip your head off because you just can't take the pain anymore. So at that point, that's normally when a patient tends to come to the practice. My recommendation, as soon as you feel pain in any tooth, like I said, when you have a cavity, always go to the dentist immediately, because odds are that you might need a root canal, or you might not. Luckily, if you go there, even if you feel pain from when you're drinking cold stuff, if you go to the dentist soon enough, you might get lucky and not have to get a root canal and just have to get a cavity. But it will be a deep cavity, and it could potentially turn into a root canal in the future. But you hope for the best. And honestly speaking, it's better to get it taken care of as a cavity, because it is a lot less expensive. It's a lot less visits to the dentist than when it turns into a root canal. So what is the next thing, and what is a root canal? So a root canal is when the dentist, what he does is that once you have this situation going on in your tooth, and again, it could also happen if your tooth is fractured, it could also happen if your tooth is fractured. And what he does is that he goes and he removes the bacteria, which is the cavity or the decay of the tooth. He removes all of that. He removes the infection, and then he puts some medication inside the nerve system to kill any other residual infection that you may have, as well as any decay from the cavity. So once that happens, and then normally on the second or third visit, there are times where they can finish the root canal on one visit as well. He removes your nerves from the teeth, and what happens is that after that he leaves your tooth hollow. So now here you have a tooth that has no nerve system anymore. It's completely hollow. The only thing is there is just the root, and part of the crown is there. Once this happens, the dentist, what he does afterwards is called a post and core, which is the second step on a full root canal treatment. So what he does at that point is that here he fills in the nerve system, where the nerves were. He fills in the roots of the teeth to strengthen the tooth on its base. He also places a metal bar, which is called a post, on top to help the top, and also prepare it for a crown. So once he does this, he does a crown prep. He does a post prior. He does a post and core. Then he does a crown prep. After that, he does an impression for a crown. It could be a metal crown. This is, for example, is a ceramic metal crown on the inside. You can get a full zirconia crown. There's different types of crowns. This will have gold, metal, so on and so forth. But once he gets it, he comes in, and then he places the crown on top of the tooth, which protects the tooth from breaking. It also gets cemented, so that way it doesn't fall off like that. But he places it in, and then it protects the tooth, both the root and the top of the tooth, which is important, from breaking. And then this you can use to eat on a normal basis. Now, you cannot, it's not your natural tooth. It's not as strong as your natural tooth. So don't open bottles. Don't chew on ice. Don't chew bone with this tooth. I mean, I honestly recommend that don't do none of that stuff even with your natural teeth, because your natural teeth, while they are stronger, can also break because of those reasons. So, try and be careful with your teeth, because really they're the only set you have, and then anything that you put on after that is just not as strong as your natural tooth. As of right now in science, there's nothing that exists that is stronger than your natural tooth. All we have are things to help you, do normal things, eating, looking aesthetically pleasing because you're not missing any teeth, and also help preventing other teeth from moving. And now, going into preventing other teeth from moving, one of the major importances of getting a root canal, as opposed to getting the tooth extracted, which, yes, it is cheaper, but getting a tooth extracted can lead to a lot of problems in the future, especially if you are not financially ready to take care of the consequences of getting a tooth extracted. One of the reasons why we never recommend getting a tooth extracted is because getting a tooth extracted, while it is it is cheaper, in the long run, it is much worse, because it does lead to a lot of other problems, like tooth movement. All your teeth in your mouth move all the time. From the day you're born to the day you pass away, your teeth are always moving. What prevents your teeth from moving is actually your other teeth. So because all the teeth, once all your teeth are erupted, meaning that they all come out and you can see them all in your mouth, in the dental field, erupted means that you can see them. That's what it means if you ever hear a dentist saying that the tooth is erupted, it means that the tooth is all out, all the way through the crown. So again, all your other teeth prevent the other teeth from moving. That's why they essentially stop moving. Now, when you get your wisdom teeth, then sometimes your wisdom teeth start pushing the teeth, and then you get crowded teeth, or that's when your teeth start bending, twisting, and stuff, and then you need to get aligners. But when you get a tooth removed outside of your wisdom teeth are pretty much the only teeth that you can get extracted and not have to worry about anything, because normally, as of right now, they don't fit in your mouth, and that's why they tend to cause a lot more problems. They tend to cause more harm than help. Really, the only exception for a wisdom tooth would be helpful is if a person were to get an extraction on the molars that are right in front of the wisdom teeth, and then the wisdom teeth come out, and then you can kind of, not exactly, but you can use it as a replacement for that molar. Granted, the wisdom tooth is still going to move, and it's not going to move in an adequate direction, but it is, because it's there, it kind of helps prevent the teeth on top from moving. Now, that doesn't always happen, but there are cases where I've seen people in their x-rays where they got a molar removed, the one on front, because the wisdom tooth had harmed that molar, and the wisdom tooth was kind of holding the other teeth on top in place. But again, the wisdom tooth was moving forward and not in an adequate position, which they never do. No tooth ever moves in the ideal position. They always move whichever way they want to, and it's always something that makes it worse. So, going into why you shouldn't get your teeth extracted, continuing on that, you don't want to get them extracted because you don't want your teeth to move. Now, what happens is, normally when you go to a dental practice, or and they start extracting your teeth, and a lot of people, they it's not that they don't care, but it's more that they just don't have the correct information of why you shouldn't remove your teeth. So the reason why, again, is because your teeth start to move, and you want to prevent that from happening. Because if you have a tooth, for example, that's let me get this tooth here. If you have a tooth and you get the tooth next to it extracted, or in the front, depending on where it is, normally that tooth will start moving in that direction, or they might start moving in the other direction, and they never move straight. I wish they did, because that would be great, but unfortunately they don't. So what happens is that when the tooth starts to move and it starts to angle, and not only does it start angling, but your jawbone that's there also starts to decay. It starts to recede. The reason why is because there's no tooth there anymore. So your body, the way it works is, the body works on a kind of a use it or lose it. So it's kind of like your insurance, it's either you use it or you lose it, because it resets for the year. Your body essentially works on a kind of like a use it or lose it basis. So if your body's not using something, then it starts to get rid of it. And eventually you just don't have it anymore. So an example actually are your wisdom teeth. There are people nowadays that are born and they grow up and they get into their 20s and they don't have any wisdom teeth. I take their x-rays and there are no wisdom teeth whatsoever. I ask them, hey, did you get your wisdom teeth extracted? And they go, no, I've never gotten anything extracted. And I go, okay, well, you don't have any wisdom teeth. You're, through evolution, and I know that people don't believe in evolution, and it's understandable, but there's no other way of explaining it that I can think of, honestly. So there are people that are born, that when they get into their adult life, normally your wisdom teeth start coming out anywhere between the ages of 16 and like 24 or 25. Normally those people at those age ranges don't have any wisdom teeth. So either they lied to me about getting an extraction, but normally you can see the evidence there of there being an extraction done, but or they just don't have it. And again, there are people that I've seen that don't have their wisdom teeth, which is, it's a good thing. But going back again, normally when your body is not using something, it tends to start getting rid of it, and the way it does it is it stops sending nutrients to it, and that area starts to just whittle away with time. A perfect example that I normally use is somebody who's a paraplegic, which is somebody who they can't walk. They're paralyzed from the waist down or just anywhere in their body. If you notice, their body tends to, in a sense, it tends to decay. Not decay, but it tends to, the body tends to whittle. It gets skinnier. The muscles tend to get smaller. Their bone density gets weaker. They're just naturally a lot weaker. So normally what they do is that those people tend to go to physical therapists, and they try to do exercises with those areas. The reason why is because everything in your body is connected through your nervous system. And the reason why it's connected through your nervous system is because your brain is what determines where things go. So when you eat food, your brain says, we're using all this stuff, so I need to send these nutrients to the rest of the body. When something in your body gets disconnected from your nervous system, your brain doesn't have eyes, and it's not exactly the brightest thing. It can't detect that part. It could be your foot, it could be your leg, it could be your mouth, even your teeth, because your teeth do have nerves, and that's why you feel pain when your cavities reach your nerve. So when the brain doesn't detect that, what happens is that it assumes that it's not there, even though it's still connected to you, and even though blood flows through it, but because it's not connected to your nervous system, it doesn't detect it anymore. So normal people that can't walk and stuff, you notice that their legs tend to get a lot skinnier. The reason why they go to physical therapists and they start doing exercises on their legs is because they, in addition to obviously wanting to work out and trying to increase the muscle, you also want your brain, they're trying to get the nerve to send a signal to the brain. It knows that when you're eating and you have nutrients, the brain goes, oh, the legs are still there, send nutrients to the legs, and that way your legs don't just eventually up and disappear. Your brain, so when you have nutrients and stuff, your brain knows to send those nutrients to your legs, so that way your legs don't just literally disappear. So it does the same thing with your mouth. When you have your jawbone, which is what holds your teeth. A lot of people think that what holds your teeth are your gums, and that's not true. What holds your teeth is your jawbone. That's where your teeth are all inside of. Your gums have a different purpose. Your gums have the purpose of protecting your jawbone from the environment. So cold, hot, acid, carbs, sugars, everything. That's what the gums are there for. So when you remove a tooth, you are also disconnecting the nervous system from your brain. So your brain, because it doesn't detect the nerves there anymore, that area of your jawbone starts to decay, starts to go down. So what happens is that all the teeth that are next to it, in addition to having that space there, and it's not only the teeth that are next to it, it's also the ones that are on top, or even the ones that are in the bottom if you remove a top tooth. What happens is that those teeth they start moving, and they'll start collapsing. It's not really so much of a movement, it's more of they tend to collapse. So you'll have the ones in your back, like your molar teeth, they start collapsing towards the front, and then you have the ones in the front that they're still collapsing towards the back. So that's why normally you'll see people that are older that are missing their molars and stuff, their front teeth, they start to separate, and that the reason why that's happening because they're moving in a backwards position. So that always happens when you get a tooth extracted outside of your wisdom teeth. So you want to prevent that from happening, and that's the importance of getting root canals, getting a partial, getting a bridge, or getting implants. The main purpose of those things is to prevent your teeth from moving and causing you problems in the future. Now, root canals are not cheap. They are expensive. And again, they tend to cost about almost 10 times the amount of a filling. So that's why you want to go to your dentist at least 2 times during the year, and whatever cavities you may see, he may find, or you may find in your own, on your day-to-day basis, get taken care of as soon as possible, because you want to prevent these things from happening. Okay. Now there are people that are prone to getting more cavities than others. So even though you get a lot, it might seem frustrating, but you want to take care of it because you want to prevent yourself from having to get a root canal or even getting your tooth extracted, because at that moment you might not have the finances to save your tooth. And then getting an extraction, because there are people that sometimes say, oh, I'm just going to get an extraction and then I'll take care of it later. I'll get an implant later, or I'll get a partial later. I don't recommend doing that, because the thing is that you don't know where you're going to be in the future. Hopefully everybody always wants to be better, but you also don't want to fall into a situation where you keep neglecting the inevitable. Because there could be a situation where you might not qualify for an implant. There could be a situation where you might not be able to get a bridge anymore because the space is closed too much. And at that point, you won't be able to get a partial anymore. So now you just have to live with that. And then in addition to that, when the other teeth start to move, they start putting themselves in positions where you can't brush well anymore. You can't floss well anymore. And mouthwash is not going to do anything in that situation. So then you start losing those teeth. And then what you were trying to save now becomes an even bigger expense. And then it comes to a point where it becomes so big of an expense where you might not even be able to get an implant anymore because you just can't afford it, or you won't be able to get a bridge because the space is too wide to support a bridge. So then the only thing you have to get at that point is a partial. And partials, while you have to use it because you want to prevent yourself from losing all your other teeth, you normally have to just get accustomed to it and living with it. You're not going to be happy per se, as if you had an implant or a bridge, because they're permanent. You don't have to remove them. And it's not something that just sits in your mouth that you've never, had before in your life. Because it's not like, some people think that you have a partial, it's like, oh, I'll be fine. Well, no, you're not, because you've had your teeth in your mouth since you were born, and since you were a year old, I guess, and 2 years old, and your teeth started erupting from your mouth. You've had them there 10, 20, 30, 40, 50 years. And now you're getting a foreign object that's not your teeth, and you're putting it in your mouth, and then you have to get accustomed to it. And God knows how long it's going to take you, months, years, never, because there are people that just don't like it at all, but they need to eat, and they don't want their other teeth, and they don't want to lose their other teeth. So that's pretty much it on what a root canal is. Again, go to your dentist, prevent yourself from getting into these situations and spending that much money, and if you do that on a daily basis, if you go to the dentist at least 2 times a year, if you have the dentist, make sure he does a thorough examination, make sure he finds any cavities that he may find, get them taken care of as soon as possible. You could potentially not need dental insurance, because you're going to be saving the money that you would be spending on dental insurance for yourself. You might not need to spend it. You can save it for when you go to the dentist and you spend the money that you have to spend there, and get whatever cavities taken care of, if you have any, and get the cleanings. If you look at the amount of money that you would be saving, you're probably looking at around anywhere between $1,000 to even $3,000 a year, probably even more. If you take your kids and everybody gets taken care of, and you take care of everybody, you can probably look up at the $6,000 to even $10,000 in savings, because you're not paying for insurance. And the benefit is that you're taking care of yourself, and you're also getting your routine checkups, which are in most of the cases are very inexpensive compared to having to pay insurance on a biweekly basis, because they're taking it out of your paycheck. So just that's the food for thought. But that is everything today for the root canals. The next thing I'm going to be going over now is periodontal disease, gingivitis, and those things related to your gums. Okay, so everyone have a good day, and as always, flourish and prosper.